Should you be concerned about muscle biopsy risks in muscular dystrophy? When it comes to diagnosing muscular dystrophy, muscle biopsy is often a key tool. This procedure allows doctors to analyze muscle tissue for specific abnormalities. It helps confirm the diagnosis and differentiate between various types of muscular dystrophy. While muscle biopsy is generally safe, it is important to understand the potential risks involved. During a muscle biopsy, a small sample of muscle tissue is surgically removed. Doctors typically choose a muscle that is affected by the disease but not severely damaged. This ensures that the sample can provide meaningful insights. The biopsy can reveal patterns of muscle fiber degeneration, enzyme deficiencies, and protein abnormalities. For example, it can help determine dystrophin levels, which are crucial for diagnosing Duchenne or Becker muscular dystrophy. Despite its benefits, muscle biopsy does come with some risks. One of the most common concerns is infection. Anytime the skin is broken, there is a slight risk of infection at the biopsy site. However, this is uncommon when proper sterile techniques are used. Another potential risk is bleeding or bruising at the site. While minor bleeding or bruising can occur, serious bleeding is rare. There is also a very small risk of muscle damage during the procedure. Some patients may experience pain or discomfort at the biopsy site afterward, but this usually resolves quickly. Overall, the complication rate for muscle biopsy is low, generally less than 3%. Most patients tolerate the procedure well. Advancements in less invasive techniques, like needle biopsies performed under local anesthesia, have reduced both risks and recovery time compared to traditional open surgical biopsies. From the perspective of diagnosing and managing muscular dystrophy, the benefits of muscle biopsy often outweigh the risks, especially when genetic testing is inconclusive or unavailable. However, it is worth noting that muscle biopsy is becoming less common due to improvements in genetic testing. Many cases of muscular dystrophy can now be diagnosed without invasive procedures. In summary, while muscle biopsy carries some risks, such as infection, bleeding, and muscle injury, these are generally minor and uncommon. It is essential for patients with muscular dystrophy to discuss the necessity, benefits, and risks of muscle biopsy with their healthcare provider. This way, they can make an informed decision that is tailored to their individual situation.